This is Dr. Tom Rosell. After 43 years of practice and over 1 million patient visits, the Rosell Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Rosell, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Rosell and the Rosell Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Rosell's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomrosell.com/education. That's drtomrosell.com/education.
The information provided on Dr. Tom Rosell Live by Dr. Tom Rosell, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey everybody, welcome to Ageless Health. And we're going to go a little bit deep into what your body tells you today. But before we get into that, I want to recap a little bit of something that I said on the radio program. And it has to do with the effectiveness of vaccines. I want to give you the absolute right data on it. So, there's this whole worry right now that Bob Kennedy is going to shut down people's ability to get vaccines. That's not the case. It's not true. That's not what they want to do. Choice is important, number one. Your ability to try what you choose to try is important. So you can say yes or no, but I want to do X, Y, and Z. That should be your right to do that. Nobody should stop you, whether it's you or your family. Now, here's the other piece of the story when it comes to that. Vaccines over the years have been promulgated to be the saving grace of so many things. In many cases, they've supported, they've helped, they've been able to modify and so forth. But also, there's a lot of data that shows that some of these vaccines may not be all of that. So I want to give you some data that I quoted on the program a little earlier. There's a required vaccine schedule, if you will, for kids going to school from ages birth to 18 years of age. And I'm going to roll the clock back all the way to the beginning of World War II. All right. So we're going to talk about 1940. In 1940, there were 2 required vaccines. Then we move it up 40 years later to 1980. There were 9 required vaccines. Then we move it up to 2012, which is 32 years later. Then there were 33 required vaccines. Then we go up to 2020, and there was 56 required vaccines. And today, in 2025, we're over 60 required vaccines from age birth to 18 years of age. Now, let me give you the other data that goes along with it. We're talking about autism and autistic spectrum problems, right? Say, well, there's some kids. Well, in 1970, there was 1 in 10,000 children that were on the spectrum or had straight up autism. And then we move it 15 years later, and we go 1 in 2,500, from 10,000 to 1 in 2,500. Then we move it up just 10 years after that, 1995. 1 in 750 children are on the spectrum. Now let's move it up to 2000, 5 years or 25 years ago, 1 in 250. Now let's go up to 2005, 1 in 166. Let's go back 10 years ago, 2015, 1 in 68. And let's move it up to 2020, only 5 years ago. It's 1 in 36 children are on the spectrum. Now, this is not me, hallucinating this information. This is straight up data. And you can check it out. Go to PubMed, go to, Townsend newsletter, go to Nature, go dig deeply and start looking at these data. And what they're projecting is that by the year 2030, and I think it's going to happen a lot sooner than that, that 1 in 2 children are going to be either on the spectrum or straight out autistic. And it happens to adults too, because now we're going and running, getting all these vaccines, and we're seeing all these autoimmune conditions and so forth. It's not okay. Now I'm going to let you sit with that a little bit, because we're going to talk about body signs and signals as we go through the program today and what your body's trying to tell you. And on the 19th, by the way, coming up February, we're already there. It's like the 26th, the day of January. On the 19th, Dr. Qinglong Zhang and I are going to co-host, and we're going to talk about body signs and signals and what it really means. But more importantly, if X, Y, and Z is happening to you, don't ignore it, and don't take 2 aspirin, call me in the morning type of situation, because it progresses. All it does when you take medications, you take a biological, it pushes down your body's immunological responses, if you will. It just covers up the problem as it progresses worse and worse over a period of time. That's not okay, my friends. But that's how we treat things today, right? How many of you got into your physician, and these guys aren't bad guys, but this is how they're being taught. They go in, you tell them what's going on, they put it all in the computer, and then they say, okay, here, take this, and we'll follow up. And before they do blood work, before they do cultures, before they do anything else, and they get that done first. That's suppressing the symptom process. Let's get into a little bit of some of these things that irritate the heck out of me. And I want you to understand immunological reactions first. And we're going to talk more and more over the next couple of weeks. And I promise you, on the 19th at the Results Center in Fairfax, we're going to get into this intimately. And we're going to show you what your body's trying to tell you. And we're going to give you solutions. We're going to tell you what you can do about it, what can be done, what the process is, and so forth. There's more and more people that are coming up with arthritic problems, arthritis or arthrosis. It's just an ending different, right? But one means one thing, one means the other. Itis, anytime you hear itis, is inflammation. It's an inflammatory reaction of something. Osis means you got a joint that's kind of old and ugly and broken down and degenerative and so forth. But it's, at that moment in time, it's not inflamed. But we hear all the ads go, it's arthritis. Well, we're not talking about arthritis today, but I'm trying to give you what takes place. And I'm going to give you something that we're seeing more and more of these type of things. And I had a personal experience with what I'm about to tell you. There's a virus. There's lots of viruses. Matter of fact, if we tested all of you, you'd probably all test positive for about 125 to 130 that you've been exposed to, and your body kicked in and did its natural immune thing, and it's protecting you. But one we're talking about is an old friend called Epstein-Barr virus. Now, back in the day, mononucleosis, Epstein-Barr, they're cousins to each other and pretty much the same type of thing. But there's a lot of finger pointing that says that this virus, that about 98% of us have antibodies to, meaning we've been exposed to it, is causing joint destruction and joint irritation. They're saying that it may be the reason for rheumatoid starting early on. They're saying that it may be all types of joint breakdown in degenerative conditions. There's a condition called acute polyarthritis. What does that mean? That means that you have poly means many, and it affects multiple joints, and it's activated supposedly, but it's active actually with Epstein-Barr. And how do they know this? Because they're going in and taking samples and looking at them underneath the microscope, and they're seeing these things show up. So Epstein-Barr virus can be an underlying triggering finger pointing to chronic pain. In my world, we see chronic pain patterns all the time. We see patients who've been everywhere and can't get it together. So what do we hear about Epstein-Barr virus? What's the deal, right? If you recall, its reputation, as we talked about earlier, is supposedly a harmless kissing disease, and it's called mononucleosis. But I want to give you another piece of it. Scientists now are showing us that Epstein-Barr is one of 6 different types of herpetic viruses. Did you hear what I said? It's one of 6 different types of herpetic viruses. And it can be passed by all kinds of stuff. We're going to live in a bubble, but what I'm telling you is that if your body's immunological system is working the way it's supposed to, this stuff doesn't get you. It's only when your immune system falters. Now, the Epstein-Barr virus is named after 2 docs, a guy by the name of Dr. Anthony Epstein and Yvonne Barr. And this goes back to 1964 when they discovered the virus, and they found it when they were looking at cancer in Africa. And it's called Burkitt's lymphoma. We know that there's an association there. So Epstein-Barr virus has been found to cause other types of cancers, including things that affect the oral membranes, the intestinal tract. Hodgkin's disease has been found, and so forth. And the list goes on and on and on and on. Is that the case 100% of the time? Well, scientists are trying to figure that out. Clinically, when you get guys like me, I'm a clinical observer. I'm the guy that is going to look at what walks in my office. I'm going to put all the pieces together relative to structure, chemical, emotional, or neurological, biochemical, bioelectrical, and what you think about and how it affects the body relative to supporting your immunological reactions or suppressing your immunological reactions. So if we kind of roll it back a little bit, and we see this Epstein-Barr virus has been associated with all kinds of immunological conditions, including this random crazy pain of fibromyalgia, the fibrous connective tissue of the body. It's been finger pointed to in things like hepatitis. It's been finger pointed in rheumatoid arthritis, we just talked about. It's been finger pointed in fibroconnective disorders, lupus, and Sjogren's, which can really be devastating to so many people. But we're seeing these viral patterns that are out there, and why they take off and attack the body and erode and destroy tissue is not because you're the favorite child and you're going to get it done and you have this weakness, but it's because of environmental impact. And is your immune system getting its butt kicked? Are you eating the sugar, sodas, coffee, drinking black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, GMO products, modified, and so forth? Is that your diet? If it is, you may have a problem. If you're stressed to the top, and you don't modify the stress, your immune system is going to be compromised. If you had pain patterns because of injury, the nervous system remembers it. It will trigger responses at that joint. So, for example, let's say that you have this virus living in a joint, your shoulders, your hips, your knees, your toes, your fingers, whatever it is. And all of a sudden, stress levels go up and you're not taking good care of yourself and you're eating things that you shouldn't be eating and you're loading it up and, and all of a sudden you start hurting. And then you go into the doc and he says, well, you have arthritis. And they take a picture of your shoulder and said, your joint's gone. We got to do a joint replacement. Wouldn't it be good to know that maybe there are other options? Number one, first. Secondly, knowing it ahead of time that you can begin to do something to protect yourself. That random pain that kind of shows up. And, so recently, 2018, there's a study that was conducted that Epstein-Barr virus could cause a number of painful conditions. And why it does that, it activates specific gene expressions, your genes, not the ones that you wear, but the ones that are in your body. And this came out of Cincinnati Children's Hospital Medical Center, and it was funded by our good old friend, National Institute of Health. They don't tell you the stuff that really is important. They just tell you things that they want you to know to scare the hell out of you. But that's a whole different story, too. So they found that this virus called Epstein-Barr virus binds, locks in, attaches itself to deoxyribonucleic acid. What's that? DNA of your gene. And it promotes autoimmunity and some chronic pain conditions. That's significant. Now, we can't hide from viruses. They're around us. You can wear all kinds of masking. You're not going to stop it because you got to live. Unless you want to be in a bubble and kind of be put on top of a mountain someplace, we have to live. And to do that, we have to make sure that we balance ourselves neurologically, biochemically, and emotionally. Now, think about all the garbage that's taking place. I'm pointing back to COVID and so forth. Scared the hell out of you, right? Told you're going to die, that you had to stay away from everybody. You couldn't see people that were in your family because, oh my God, you might bring them something. And then they said, you got to take this and do this. And, oh, by the way, now we're going to give you something called Paxlovid if you happen to come down with this variant. But what they didn't tell you is that when you took the Paxlovid, you actually got sicker more often after that. Do the research. It's there. I'm telling you the truth about what's really taking place. So what's the person to do? Well, you got to find out first what your body is telling you. So body signals, okay, which we're going to cover on the 19th of February here at the office. Body signals are finger pointing. They're telling you that there's a problem. And when you ignore what it's trying to tell you is when it builds up and it gets into trouble. So let's talk a little bit about, what those signals might be, because it's the process of understanding the communication. It's understanding what your body's trying to have a conversation with you about that we ignore that can be destructive, right? So if you have a chronic pain in your body and it gives you a headache, or it gives you shoulder pain, or it gives you knee pain, or it gives you back pain, and we ignore it, we think it's going to go away. We take a muscle relaxer, we take a tranquilizer, we take a pain something, but it doesn't go away. It begins to cause abnormal mechanical processes in the system. And then the wear and tear, the modifications that we have to do in our lifestyle begins to cause further problems that we don't understand where they came from unless we look at it. How about, the constant fatigue that we may have? Well, it's your thyroid. Oh, you're anemic. Oh, you're just not processing oxygen the way you're supposed to. Well, great. Why? What's the underlying triggering mechanism? If you understand that it can be neurological, it can be neurological and biochemical, It can be your processing, your stress levels, your oh my God attitude. If you can fix that, you can fix the problem. I've had patients that have been given up uh, or have given up the possibility of resolving anything because they've suffered so long. Their doctors have put on medication after medication after medication. And they come in and said, I'm not sure what I'm doing here, but I don't know what else to do anymore. I've tried everything. And then we start asking questions that were never asked before. Like, where did you grow up? What vaccines did you have in your body? Where did you grow up important? What happens if you grew up in Buffalo, New York, or Pittsburgh, Pennsylvania years ago? What's the problem with that? It's called steel production and the coal burning furnaces, and the off-gassing of something called mercuric oxide and the cancers that come across because of those things. So you have to ask the question, were you ever injured? What medications have you taken often? And how many times did you get a vaccine? Which vaccines did you take? Let me look at your diet. I want to take a look at that. What kind of exercise do you get? What's your body composition? And you start putting pieces of the puzzle together. Now you can do something about that. But if I don't ask those questions, and I don't ask, have you had what we call the yet disease? So if you got a neck and shoulder problem, I ask you, have you had any pain in your hand yet? Because the nerve root comes from your neck down in your hands. It could be the same pattern. What kind of dental work have you had done? And the question goes on and on and on. So that fatigue, that off and on fever, that just kind of comes and goes, joint pain that's random, the swelling that takes place, they're all indicators. Now, we're going to also get into what your body says. What does the tip of your tongue look like? What happens if you don't have any luna, the little round moons on your fingers? If they're not there, your immune system is struggling, my friends. What happens if you got a big, deep, vertical line in your ear? And that's combined with the tip of your tongue. That can be your heart. And if that's it, we better take some action and do it quickly. And not just put you on a statin, which can make life a whole lot worse in a lot of different areas. And there's tons of research that will show you what that's all about. Or put you on an aspirin so you can bleed intestinally ongoing for a long period of time. But on the 19th of February, we're going to answer questions. But we're going to show you exactly what your body's trying to tell you. And then we're going to give you the information how to turn it around. So make sure you listen to me the next couple of weeks. I'm going to get into very specific details on the language that your body is trying to use to communicate with, and what we're doing when we ignore it, and when we say, oh, it's okay, it'll go away. It'll rust up and I won't have to worry about it. I don't know about you, my friends, but when things like that are ignored, you end up in a very bad place as time goes on. You're either going to be taken out of this world slowly, one piece at a time, one disease at a time, one upset at a time, or wouldn't it be nice to live brightly and strongly, knowing what your body's saying, having great communication back and forth with it, and then being able to support it until we're all going to leave at some point, but leaving on our terms? I would think so. So join me on the 19th, Dr. Zhang on the 19th, and we're going to go over this in detail for you. I promise you're going to go away with a ton of data, more information than you thought that was relevant. Having said that, come and talk to me. Ask me questions. You don't have anything to lose except getting rid of your bad health. Okay? I'll see you next week. We're going to continue the process. We're going to talk about this ongoing. And remember, the reason I dedicate myself to doing this and sharing information is because I love you all. You deserve it. You need to follow me on all the social media sites, sign up for our newsletters. You can do that. Just go to drtomrosell.com. You can do it that way. Go to Facebook, go to Instagram. You can go to any of the ones that you like to. We're all there. We're there every place. And tell your friends about us. Having said that, have a great Sunday. I'll see you next week. Bye. you.